Morning report.
Alright guys, ready for a report?
Yep.
We have a newly admitted patient, Christina Broscheid, age 24, just came in last night. Voluntarily admitted herself during a manic episode. She has a history of bipolar disorder and alcohol abuse. Had a blood alcohol level of 0.19. Patient was disruptive and has been up for most of the night.
All right. Well, she's in my unit, so I will go take care of her.
Alright, sounds good.
Day 1. Orientation phase. Development of trust, parameters of relationship, confidentiality.
Hi, Christine. My name is Sarah. I'm going to be your nurse today. I'm actually going to be your bigger for the next 5 days while you're here for your treatment. I'm just here to help you out with your treatment walk. And yeah, how are you doing today?
Well, I'm doing okay. I want to drink. I think you'll help me out. I'm a little thirsty, so I'll give you some like alcohol vodka that works with cranberry too. I love it. But I'm doing good. I'm doing really good. I'm doing great. I think maybe I could just leave now. Maybe I don't need to stay. Yeah. So could you give me a drink?
Well, I can give you some water after we're done here.
Okay.
But for now, would you mind if I bridle?
That's fine. Yeah.
All right.
Go ahead.
Awesome.
They're gonna be good.
Yeah?
They're gonna be
All right.
perfect.
So I am going to start by taking your pulse. Can I grab your wrist?
Sure. It's good, right? It's perfect.
Yeah.
Great.
There you go. Right, your pulse is at 105. Yeah, that's
Good. More than 100%, right?
All right. I'm going to take your blood pressure next. So can you extend your arm for me?
Yeah, of course.
All right. Awesome.
Now this is spiffy.
Yeah.
I really like this. How do you like being a nurse? You like being a nurse?
I love being a nurse.
Maybe I'll go to nursing school. 'Cause
Yeah?
This looks really cool. I want one of these. This is fun.
All right, so now while I do this, I'm going to need you to stay quiet. All right, so I can
I'll
hear.
try. Okay.
All
Try to
right.
be quiet. I'm trying to be real quiet.
Awesome, thank you.
Okay.
It's going to get a little tight on your arm.
Good.
All right, everything is good, yeah?
I'm not see. Told you. You don't even need to do this. Told you
All
nothing's
right.
wrong with me. And
All right. All right, so, how are you feeling? You seem a little,
I'm good. I'm feeling really good.
yeah?
I do have something to tell you though.
Yeah.
It's like weighing on me a little bit, and I've been thinking about it, and I think, but you can't tell anybody. It's a secret.
Okay.
Okay.
Well, now you need to be aware that if it has to deal with your treatment, that I am required to tell the other members of the healthcare team.
Okay. All right. Well, okay. Well, I'm gonna tell you anyways because I want to tell you because it's like weighing on me, and I think if I tell you, I'm gonna feel better. So, sometimes I forget to take medication, and I just forget because like my life is busy and I do other things. So I forget, and then like 3 days I won't take it, and then on like the 4th day I'm like, oh my god, I didn't take my medication. So when I'm drinking, sometimes I'll take my medication with some shots. Yeah, so this happens kind of a lot. So I kind of forget to take my meds. So is that bad?
Well, it's probably not the best for you to do that. However, because this does deal with your treatment team, or with your treatment, I am going to have to tell the rest of the treatment team. So if you excuse me now, I am going to go do that. But I will be back here at 2 to pick you up for group, and I might stop by and get you some of that water that I promised you. All right?
All right, that's fine. All right.
All right.
I'll be fine.
I'll see you in a little bit.
Okay, sounds good. See you later. All right.
Hi, Christine.
Hi.
I am back
Thank
with
you.
your water.
Thank you so much.
Are you doing okay since I last saw you?
Yes, but I was this was great. Thank you. But I wish that it was alcohol. I do miss it. I really feel much better when I drink it. And I used to party a lot.
Yeah?
And drink a lot and stuff like that. And it's fun. It's so fun. I feel so good. Do you ever go out and drink and party?
You know, thanks for asking and all. However, we are here to talk about you and to deal with your treatment. So we're not actually going to talk about my social life. Is there anything else I can get you though before I come back to get you for group?
No, this is good. Thank you.
All right,
Thank you.
awesome.
All right.
I will be back in a couple hours.
Okay, all right. Thank you.
Yeah, bye.
Day 2.
Hey Christina, it's 2 o'clock. I'm here to pick you up for group. You ready to go?
No. Well, I don't need to go to groups. I'm having a great time here. I did my makeup. And we could just do your makeup. Just sit down. Come on.
You know what? Thank you. But I actually already did my makeup this morning, so
He's a little more.
no, maybe next time. Your colors are great though. You know, as part of your treatment treatment plan, it is highly recommended that you go to these groups.
I don't have any problems. I can just leave. You could just discharge me right now. And no problems, no groups. That's okay.
You know, it's just gonna help you to focus on some of your coping skills so you can take care of yourself once you leave.
Okay, fine.
All right.
Go.
Thank you. Great. Just come
Okay.
on over here.
All right.
You can come have a seat.
Hey, how are you doing? I can do your makeup. You sure?
No.
Come on.
No.
Come. Oh my God. I had a really good time in my room doing my makeup, and I don't know why I'm here because I don't have any problems. No problem. No.
Welcome, everybody. I'm so glad that you could all make it. Today is Saturday, September 10th, 2012. We are going to focus on some coping skills, ways to deal with stress. Does anyone have anything to share or how they deal with their stressful situations?
I like to eat when I'm stressed. You know, I really like Rice Krispie treats. I eat a lot of Rice Krispie treats. Like sometimes I'll put Cheerios in them, or even Fruity Pebbles. But you know, ever since they made those jumbo marshmallows, it's been kind of stressful making them. So I might have to switch to something else. Yeah.
Oh, okay, awesome. And Christina, do you have anything to share?
Nope.
Any way that you deal with stress?
Nope.
All right, well, thanks for taking the time to come. There is another group that's meeting tomorrow at 2. I would love if you could make it all again. Definitely try to have something to discuss when you get here. It will just make group go a lot more smoothly. All right? All right, you guys.
Day 3. Working phase. Client's resistance to working on issues is overcome. Problems to focus on are defined as well as time commitments. Client comes to meeting with a topic to discuss.
Hi, Christina. Hi. I'm here to get your vital signs. You don't mind?
No.
All right, awesome. So first thing, I'm going to take your pulse. How have you been feeling?
I'm feeling better. I got more sleep. I'm taking the medication more regularly, so I feel like that's helped me calm down a little bit, kind of come down off my mania. You know, I'm feeling much better. But the schedule and sleep.
Yeah.
You know.
It's nice now that you're getting some sleep. You haven't felt depressed or anything.
No.
Good. All right, I'm going to take, we're going to listen to your lungs for a second.
Okay.
So if you could just stay quiet.
Okay.
Take a deep breath in. All right, everything sounds good.
Good.
I'm going to be back in a little bit to pick you up.
Oh, at 2 for group?
Yes.
Okay, yeah, and I was actually thinking about a topic so that I'm going to share. So.
Awesome. I'm glad to see that you've overcome your resistance to working on your therapy.
Yes.
All right, I will see you in a little bit.
Okay, bye.
Bye. Hey guys, welcome to group. This is Thursday's 2 p.m. group. Before we get started, my name is Tara Kettler. I'm going to be running your group. If you haven't met me before, does anyone have anything to discuss?
Well, I do.
Awesome. What do you have, Christina?
Well, I've been thinking kind of because I know we talked about coping skills last group, and so I was thinking, what did I do when I start feeling that I'm getting into my manic phase? And I realized that when I do feel like I am getting there, I start to drink. And that's when I start to abuse alcohol, and kind of just goes into a cycle, and I just kind of keep going down, and yeah, and that's what I wanted to share.
All right, well, I'm really glad that you came with a topic to discuss, and we are focusing on the problem so that we can learn some coping skills. Have you ever tried any other ways besides drinking to handle your manic phase?
Well, I did used to talk to my therapist, but I lost my job, so I lost my benefits, and I can't afford to go to the therapist anymore, so I haven't gone for a few months now. But I did feel that did help me when I did go.
Okay, awesome. So you're saying that like when you went to your therapist, it helped you stay away from the drinking and maybe better control your medication?
Yeah. I mean, not completely. I still had my faults, but it was definitely not as bad as it is now.
Okay, good. Would you by chance like me to look into resources to help you get into that therapy again?
Yeah, I think that would be very helpful.
All right, well, thank you for sharing. Is there anyone else who has anything to discuss?
Day 5. Termination phase. Summarize work accomplished, identify options for support, may stir up emotions in client and nurse, stay aware of boundaries.
Hi, Christina.
Hi.
Today's your discharge day. How are you feeling?
All right. I'm a little okay.
Yeah?
Yeah.
All right, well, before we leave, I just want to go over all that you've accomplished during your stay here. During group, we've talked a lot about coping with the stress of, your manic phase, your mood swings, your alcohol abuse. You have brought in so many good examples of ways to cope with this stress, and I'm confident that you're going to be able to implement them in your life. So I've talked to a couple of the social workers here at the hospital along with their case manager, just to kind of give you some examples of, your group therapy. We did find a few good options. I have some pamphlets here that you can look over in a little bit. There is a group that meets twice a week here at the same hospital, and then there's also one that meets, 5 days a week. So it's kind of up to you what you think is going to best fit your, your life from here on out. But yeah, so.
Well, yeah, I'll definitely be going to one of those.
Yeah?
Yeah.
All right, awesome. So, how are you feeling about leaving? Because this can be a hard time.
Yeah. Well, I'm happy to go home. I'm happy, I'm feeling better. Kind of like you said, the coping skills. But it's kind of sad to leave and, leave everybody. And do you think once I'm discharged, we can hang out, maybe, go out?
I'm really glad that you're happy to go home. However, it's still inappropriate for us to hang out outside of the hospital. Just in case that you were to ever come back, I wouldn't be able to give you the proper care without bias.
Okay.
But, our relationship needs to remain strictly professional. Although it is sad to see you go, I am happy to see all the progress that you've made.
Okay.
All right?
All right.
I'll be back to see you before you leave.
Okay.